I think it's important to understand healthcare is one of the most complex industries in our world, if not the most complex. And understanding the complex system science behind that, we have to really understand how to put all these complex patients into definable patient care processes. And that's what the pathways are. When you understand the need to have a definable process around the most important process in healthcare, that's our patient care, you can then begin to measure the outcomes of that process. And if you're not measuring value, it's really difficult, if not impossible, to improve value. And value really is the combination of quality measures, patient experience, and the economics behind the cost of that whole process. And it's not easy to do, that's why you haven't seen it, but it's absolutely necessary in healthcare. If we're going to decrease the cost of healthcare and still improve outcomes, we're going to have to be able to understand how to measure value in the context of a whole definable process of care, and that's what the pathways are. So the pathways are a necessary step to be able to measure value. And then as we use data and data analytics and these multidisciplinary teams, we can begin to get insight into how do we decrease costs at the same time we're improving outcomes. And there's going to be lots of tools for that. There's going to be lots of ideas and new technologies. And it's also going to be understanding the variety of variables that patients bring into the process we can't control. But as we get data, we can understand how to align the right treatment, the right care for each subpopulation of patients within these pathways. Yeah, the neat thing about working in multidisciplinary teams and looking at everybody's perspective, and I'll tell you, I think one of the future potentials is to bring in more of the patient's perspective. As we all work together around these patient contexts and we get data and we're measuring value, we begin to have more and more insight and to discover things that we may not have thought about. One of the things that we learned in our hernia pathway was that the emotional state of the patient preoperatively impacted outcomes much more than we ever thought. And that came through measurement of the data and then outcomes. And once we did the data analysis, it showed using a lot of nonlinear types of analytics to look at weighted correlations rather than direct cause and effect, that the highest modifiable factor preoperatively that predicted outcomes was the emotional state of the patient. So we've implemented a lot of preoperative improvements in our process for hernia repair. And I think that'll apply to a lot of other pathways as well. I think one of the things we've been able to see as this whole journey has been implemented over the last several years is it's impacted a lot of the outcomes that you measure as an organization. So we've seen decrease in mortality, decrease in complications. We've seen improvements as an organization by decentralizing the work to the individual patient pathways. And I think that's an important learning. A lot of places try to change the organization at the central level, and that can work a little bit, but it really doesn't work sustainably unless you decentralize it down to the patient level. I think that's one of the big learning and documentation of the success of doing this. Well, I think one of the backstories of this is the culture and the relationship between the hospital administrators and the physicians, because I think still today that's quite unique. So I think this is very challenging to do in an organization where administration and the physicians are kind of battling each other and battling for resources, and that unfortunately is fairly common in our healthcare system today. And so I think one of the backstories that's really important is the collaboration both between hospital administration and physician and other staff, and even between different physician specialties. It's fairly unique, having worked in other organizations over the past 2 decades. I think that's some of the backstory that's really important, is the culture that allows this and facilitates this to happen.